Hi, I'm Dr. Kelley Gurley, and I serve Takeda Pharmaceuticals in the role of PDT, Data, Digital, and Technology. I'm responsible for managing the financial aspects of our function, as well as driving the portfolio strategy, all of the digital transformation, the governance, and anything around value orchestration and the continuous improvements in our organization. In my TEDx talk, I spoke about the remembering the human in disruptive change. It's something that's very close to my heart. I really believe as leaders, we need to lean into our more empathetic side and be vulnerable. And remembering that we ourselves have gone through significant changes in our lives, both career and personal, I think is really important to help us lead with empathy when we are asking teams to make a change that could be potentially disruptive to their ways of working. I think it's really important in the changes that I've led and a lot of the digital transformations. It has really, really helped me while I'm driving the change when I take that moment to ask the questions, not just who will be impacted and how they'll be impacted, but how do they feel about this impact and drive communications from that perspective of helping them understand sometimes why the impact is needed, but how they can really help embed and help the impact be successful. We can't deliver outcomes without humans. So we do have to start by ensuring that we think of the human first before of the technology that we're trying to drive and that deliverable. It's crazy for me to be in the industry almost 25 years. And I remember when the electronic health records was just a thing that we talked about and it wasn't as popular, and there were so many challenges around how would we integrate records, which we still have, but I think we've really come to a place where we're able to take information from disparate systems, analyze them, and use them to help drive our patient outcomes, right? We're able to look at data and make those correlations, in terms of things like rare diseases, right? Able to prompt doctors to say, hey, we're seeing, these types of the diagnosis for this patient, we're seeing these types of outcomes, maybe take a look deeper into something. And I think that richness is so incredible and helping us drive, right, the betterment of our treatments for the patients, being able to create more preventions, especially in a healthcare arena versus being reactive, right? A lot of things are just easier to prevent than it is to treat. And I think that's one of the big things that I am seeing, that shift towards really digitizing records and creating better ways for us to access it. Yes, we are really working hard to be more of a data-driven organization versus being a data-led through analytics. I think there's been so much data that's been collected over time. In my career, that was one of the things, was collecting the data, but I don't think we were really using the data to effectively drive the business. I think that's been the gap, right? Collecting it, but not using it. And I think I am seeing the change. I think a lot of companies are really working on becoming more data-driven, working on real-time data to help them make better business decisions, as well as, for me, I've been in healthcare. So for me, it's all about being able to be better to our patients, right? And create better outcomes for them. But analytics is really, and the push towards using analytics is really, to me, a big disruptor that is leading a lot of good changes and incredible outcomes for our patients. I really am fascinated with things like the metaverse and anything around VR, because we are leaning towards having more hybrid workspaces. But I do think we need that equity where people can meet, at the water cooler or at something fun. And I think using these incredible tools to create spaces where it's not just you're sitting on Zoom or you're sitting on a Teams meeting and, it's 5 minutes to cut off, so you're wrapping up so you can go to your next meeting. But maybe these opportunities where we have these passive spaces that you can show up to and probably meet somebody that you would not have met in a meeting because they just happen to be, in that space that day, and you get an opportunity to meet them. I know a lot of teams are using the VR type approaches to help with education now and starting to train. I've seen it being used in certain manufacturing capabilities where they can use that to train folks remotely, because it is challenging to sit and read SOPs all day long, where it's, as humans, we really learn with our engagement, right? Engagement of the activities and practicing the activities real time, and being more physical. That's such a great way of learning and having it stick. So I do think the use of virtual reality is going to start shifting the ways of working and the ways that we operate. And I think it's a good thing. It's great to be here on the other side of where technology is becoming much more embedded into the work that we do, and we can have fun with it as well.